The Affordable Care Act, good, bad, where are you?
The Affordable Care Act is important. We have always believed in access to health care for all Americans, and long before the debate really started. I think I'm a physician, I'm the father of a cancer survivor. It'd be unconscionable for me to imagine in a country that I live in where Americans couldn't access health care. I think the Affordable Care Act goes a long way towards what needs to be done. I think there are some things that need to be examined in addition to what the Supreme Court has just upheld.
Like?
Well, I think we have to take a good look at medical malpractice. I think that's an area that's ripe for reform. And it's ripe for reform because so many physicians practice defensive medicine. So the prescriptions, the cost of diagnostic tests, are all part of this. I'm so afraid of being sued by a patient that I'm going to go the extra mile. And I think there's inefficiency and waste in those decisions.
How much additional cost do you think that adds? There's been lots of studies. Some have suggested that it's a lot. Some suggest it's actually only on the margins.
Yeah, I don't think I can put a dollar figure on it. And I think it does vary a bit. The problem is that how we want to incent the decision-making in our healthcare system, particularly when we've got these big challenges, defense spending and some of the entitlement programs. We've got huge challenges. So do we want that driving the decision-making when what we really need to do is wring out productivity improvements and spend?
When you think about healthcare insurance, medical insurance, do you want people paying more out of pocket than they do today? It's a big debate in terms of how it would incentivize and change the environment.
So this is part of the conversation that I've just whispered in the president's ear, the conversation around ethos. Because if we're going to have that conversation and make that assumption, then there's a personal accountability part to this as well. And I think that we should decide what we're comfortable with as a society. But yes, I think that there should be some personal accountability for
How would you structure
your own health care. I like a lot of the provisions of the Affordable Care Act, to be honest. I like the notion of the competitive market forces driving price in the exchanges. I like that as a convenient vehicle for providing care to the currently uninsured or underinsured. I think that goes a long way. I think there's a lot to be said. I love the fact that my kids, when they turn 21 or graduate college, can stay on my insurance policy. I love that because Andrew, the oldest son, the cancer survivor, graduated 2009 from Harvard, and the day after he graduated, $700 a month that we had to pay to cover him, $700 a month. And we had to carry him for a year until he found employment. It's almost $5,000 in supplemental insurance.
Is his insurance today cost more?
His insurance today costs more than it cost us?
No, given his prior treatment.
You know, I would dare say it probably did. I would dare say that $700 was reflective of the prior condition he had. And I love the fact that we've eliminated prior condition as an exclusion in the Affordable Care Act. So there's a lot to like about the Affordable Care Act.